Hey guys, welcome back to another Something in About 5 Minutes. In today's episode, we are going to explain a very special technique that I'm surprised many of you don't use when considering manual C Spine Stabilization. So let's get started. So this was actually very interesting to me. When I showed a group of EMT students this a couple weeks ago, it occurred to me, being that I talked to a lot of the other EMTs that were around the same organization, that they were unaware of this manual stabilization technique. And it kind of surprised me because I've been using this technique specifically for years. And I just felt like it was common sense and that more people would be utilizing it. But once I talked to these established providers in that it was not taught, and they started using it because they were like, oh my God, this is awesome. Even other providers that they were now doing this in front of were like, oh my God, I've never seen this. So when we think of manual C-spine stabilization, this is really what we're thinking about, right? When I say to you manual C-spine, this is where your body would automatically go to. Hands are on the sides of the head, covering the ears, and you're kind of in this like yoga type position. That can be very hard on the knees. It could be very hard on the back. You know, you're resting your arms on your elbows. Maybe you're down on the ground and you're waiting for either a C-collar or somebody to either relieve you or something like that. Now, sidebar, this technique cannot be used on people that are sitting up, like in a car or something like that. But if you're like in this diagram, someone that is laying on the ground needing C-spine stabilization, this technique is absolutely going to work every single time that you use it. So what I want you to do from now on, and here's the other thing, right? When you're in this position as a provider, once you have someone take C-spine stabilization, they are out of the mix. They're gone. Their hands are tied until something is done to rectify the situation so the patient can't move, whether that be a C-collar or a backboard or something. Their hands are tied. They're done. That provider is completely useless because their main objective is to not paralyze the person. So now, how happy would you guys be if I could teach you a way that frees up their hands to be able to be used? And that is where I want to go with this picture right here. This picture is what I want you guys to start doing, okay? Take your knees and put your knees on either side of their ear, okay? So I want their head, I want the patient's ears, okay, on the inners of your thighs, okay? Your knees should be touching their shoulders and close in, okay? Yes, it kind of looks weird. However, you know, if they're conscious, if they're unconscious, it could be kind of like, hey, you know, this is kind of embarrassing, whatever. However, if you explain it properly, you guys can put this into effect, and now you're holding C-spine stabilization in a Loctite manner where now your hands are completely free. You can bag the person, you can do an assessment, you can grab stuff out of your drug bag, your monitor, whatever you need to do, you can now do it because your hands are free, but you're still maintaining C-spine, right? As long as you don't move your legs, and you're only moving your upper body and your arms, you can control C-spine stabilization perfectly. So guys, I just want to reiterate here, make sure that the knees are touching the shoulders and that your inside of your thigh is right over their ears. That is going to be the best position that you can maintain stabilization, manual C-spine stabilization, without having to use your hands. It's a more comfortable position and it frees up your hands, more importantly, to be able to utilize all of your stuff. So I'm actually very shocked that more people didn't utilize this or didn't know about it, but now that you have, please, in the comments of this video, make sure to tell me if you have used it and how much of a lifesaver it is. Till next time, guys, I will see you guys next Tuesday.